A few people have asked why it's okay for us to be opening up when there's still a big chunk of the population, namely kids, who haven't been able to get vaccinated, and it's kids who are spreading COVID.
Excellent question. So I guess I would say, firstly, correct you on one point there. It's not really kids that spread this virus through the community. What we're seeing now is that a lot more kids are getting infected because, as you say, they're not the vaccinated population. So it's not necessarily that kids are this sort of vector of transmission like we see with other respiratory viruses like flu. It's just that they're the unvaccinated population at the moment. What the rationale behind the whole vaccine rollout was to get the vaccine to people who were most vulnerable to severe disease. And of course, that was the elderly, people with underlying conditions and so forth. And then get it to the people who were spreading the disease the most. And that was actually younger adults. And then slowly get it to kids. You can't immediately roll out a vaccine to kids because the pediatric immune response is very different to that of adults. So you can't just assume what works in an adult will work the same as in a child. You need to do pediatric specific trials. So obviously they take time. On top of that, what we know is that if kids get infected, they have a less severe disease than adults. So the sort of rationale for this was, if we can vaccinate as many adults as possible, we're vaccinating those who are most vulnerable to severe disease, those who are most likely to transmit it. And if we can get the vast majority of adults vaccinated, then we can reduce the amount of SARS-CoV-2 that's circulating in the community. And then in that way, we can indirectly protect our kids. There is a need for pediatric vaccine rollout, and we're seeing that. So hopefully in the new year, we'll have vaccines licensed for children as young as 5. And Moderna and Pfizer are actually testing their vaccines at the moment for children as young as 6 months. And they're saying that data should be available in the early new year. So I guess don't be concerned that there's not a vaccine available for all kids at the moment. It was a strategic decision and it was correct with how this virus spreads and who it affects. But there are certainly pediatric vaccines in the pipeline.
Mm-hmm.